Hi, this is Dr. Saumil Shah. I'm a board certified plastic surgeon specializing in aesthetic surgery. I'm the director of plastic surgery at Skinzone Clinic, Mumbai. So this lovely patient came to us. She had been exercising and she lost a lot of weight, about 20 kgs in last 2 years. Unfortunately, in spite of all her best efforts, she couldn't lose weight in specific areas which had stubborn fat like the lower abdomen, her flanks, her lower back and some amount of fat in her upper abdomen. So for this, she specifically came to us for getting her shape better and to remove this some fat. What she wanted initially was just some liposuction from her lower tummy so that she would be able to wear better clothes and better fitting clothes. When she came to us, after examining her, I decided and I spoke to her, I counseled her that she would get best results if we did what is called as a 360 lipo. In 360 lipo, we basically do liposuction of her upper abdomen, her lower abdomen, which is what she wanted, also her flanks, her lower back, her mid back. What this helps us do is sculpt her body or carve her body into a look that she desires, which was basically a silhouette, which was the S-shaped curve that most women desire. Now along with this, we also advised her to get some fat grafting done to the sides of her buttocks, the hip dip areas, so that she can also get a silhouette where it was basically with the waist going in, the hips having a nice smooth curve and then tapering into her thinner thighs, where again we did some liposuction for her upper thigh. After speaking to the patient, she decided yes, she would want a 360 lipo with fat grafting to her hip dip areas. So going ahead with this, the patient had to get admitted into the hospital and it was done under general anesthesia. The steps we do for liposuction is what is basically called as SAFE lipo, SAFE, which is separation, aspiration and fat equalization. In this separation phase, what we do is basically during the first phase of infiltration of fluid that we do so that there is less blood loss and liposuction becomes more efficient. We also separate the fat out using the micro air device. We separate it out from its bed so that it is much easier to aspirate or to remove the fat during the actual phase of liposuction. We use a motor during this device to help us do this much faster. During the liposuctioning phase, which is the aspiration or sucking the fat out phase, we use a device called as micro air, which is a power assisted liposuction device, and this helps us do this in a much better, faster, easier way, and it helps us sculpt the bodies in a much more controlled manner. After this, there is the third step, which is the most important and a revolutionary step in this method, which was developed by Dr. Saumil Jr., which is called as fat equalization. During this method of fat equalization, we basically use the micro air machine which vibrates without doing the suctioning so that any deformities or any lumpiness is resolved and you get a smooth appearance under the skin after the liposuction. After doing this liposuction and removing the fat, this fat was accumulated in a sterile container. We processed it and then we used the same fat to put it into the hip dips through a method called as EVL, which is expansion, vibration, lipofilling, using the micro air device. This is again a new technique developed by Dr. Saumil Jr. and it has given very good results and cut down on the time in which we do the fat grafting, which is very helpful when we want to do large areas. So if you have stubborn fat or you know someone who has stubborn fat who in spite of their best efforts and who want to follow a healthy lifestyle cannot lose that last amount of stubborn fat, liposuction is the treatment for you. It is a safe treatment and usually the fat does not come back if you follow a healthy lifestyle. For understanding more about how you can shape your body better, talk to your plastic surgeon as to what are the areas the liposuction can be done for, and do contact us if you have any queries. Thank you.